I was prepped for PD catheter surgery, and I was told that that one fingernail that I left out was okay, and that worked out fine. This is my new PD catheter. I will not see it until I get it checked and changed next week.
This is one day after my surgery. I had my surgery yesterday for a PD catheter placement for peritoneal dialysis. I just wanted to touch bases on some of the things that I mentioned on my prior video before I had the surgery. Um, the fingernail, I was told that that was okay to have one fingernail out because then they can monitor it. And I did notice when they put that thing on a fingernail that had polish on it, it was not registering correctly. It would register, then it would stop. So I would tell anyone that if you can remove your polish, just remove it. It would be easier and better in the monitoring. When it was on this finger, it was fine. It did what it needed to do. It never acted up or anything. So that is true, and that is the reason why they want you to remove your polish. Also, the pain threshold. I said I was going to mention that. Well, you see, I'm sitting here now. I feel okay. Um, I will say this, that after surgery, it did feel like a 7, even though the how can I put it, the anesthesia was still in my system. I still felt a pain of like 7. It took me a minute to really feel more aware, just like any surgery. Anesthesia has to wear off, which I feel like it's kind of wore off now. I did that. I was given pain pills, not high strength or anything, I guess, due to me having kidney failure. But I was given pain medication. I did take some last night. I haven't taken any today. I may take some in a little while. I don't want to be dependent on it, but it does. It still hurt. It's sore. They said I will be sore maybe for a few days. You're not supposed to drive. They say 7 days after, just to make sure that you could heal. So if you're working, I guess you could go back to work and just be very careful and cautious because as I'm talking now, like I said, it's very sore. Um, but it's not on a pain threshold from 1 to 10 right now, and this is the day after surgery. I would say it's about a 3 or 4. Um, and I also feel like cramping. It feels like menstrual cramps, to be honest with you, not to give too much information, but it do feel like menstrual cramping. I don't know if that has something to do with the surgery. I don't know if that happened with everybody, but that is how I feel now, like, just menstrual cramping. And when you get up and get down, you do feel funny. Other than that, the day after surgery, I feel okay. And I just got to keep healing. I do go to the doctor on Thursday. That'll pretty much be like maybe 6 days after, and they will change the dressing. I guess I'll get to see it then. They did place it from the picture you saw prior to me speaking now. The picture that I had on there showing where the catheter was placed, I did make sure when the doctor came in before they got me ready to go in, I told him where my pants sat. So that's something you may want to explain to your doctor to let him know where, to make it more easier for you. I hope it really will fit right. I haven't put on any pants this morning to see whether it is exactly where I needed it to be, but from where it is placed, I really think it is because where my underwear line is, my jeans usually are kind of low rise. So they do go a little above that line. And if you saw, and I'll just post it one more time after this, you'll see that it is right above my panty line, which I think the thing is still a little higher. The catheter is still a little higher. So if you have any questions or anything to this video, you can ask me. If I left anything else out, I'll be sure to get back with you with more videos. I'm going to keep posting videos in this series about this PD catheter, all the way up to even doing dialysis. I plan on trying to showcase that too as well. I know it's a lot of PD videos out, but I still want to give you my journey all the way until I feel comfortable, and hopefully I can help someone else out there. But again, I feel fine, and you can do it. Don't be so scared. I was so scared, and I know I'm a person and I'm a believer of God, but you always going to have a little fear of the unknown. And I hope I can help someone that may have a little fear or had some of the questions that I had. And also pertaining to when I brought up in my prior video about smoking. So I got through the surgery okay, thank God. Nobody told me anything as far as my breathing or anything that went wrong. I had a very sore throat yesterday. After the surgery, I don't know, if that has anything to do with anesthesia or whether they put something down your throat to breathe. They don't tell you that. I'm honestly thinking that maybe they don't tell you that because you would be scared, because I would have been if they would have brought that up. But again, I'm doing fine, and thank you for watching. And hopefully, again, if you have any questions, please feel free to ask me. I have no problem answering them because this is what I wanted someone to do for me. You have a good day, and I'll see you on the next video. And I think the next video will be most likely the day that they check it, and when I arrive to the dialysis center to meet my PD nurse, and she's gonna, I guess, change the dressing. I don't think they're gonna do anything else but change the dressing. It should not be healed enough, I guess, for them to flush it or anything else. But if so, you will know about it. I will definitely tell you. And again, thank you for watching, and hopefully you'll continue watching these series until you get familiar with it, as well as I'm going to try to get familiar with it. This is going to be a help for me to go back and watch, and hopefully this is a help for you. Thank you again for watching. Bye.
Discuss with your doctor where you would like to have yours placed. This is where mine was placed. See you next time.